COVID-19 vaccine. Mexican doctor hospitalized after vaccination. Mexican authorities are investigating the situation of the 32-year-old female physician. Recent reports confirm that the doctor has been admitted to the ICU of a public hospital in Nuevo Leon. Initial findings established breathing difficulty, skin rash, and seizures experienced by the patient. The health ministry said the initial diagnosis is encephalomyelitis. According to Reuters, encephalomyelitis is an inflammation of the brain and spinal cord. The authorities also added that the doctor has a history of allergic reactions. Major health organizations warn people with a history of severe allergy not to take COVID-19 vaccines. If they want to, they must inform the vaccine administrator about it. This is because they are at risk of severe reactions like anaphylaxis. The health ministry found no evidence that any participant in the clinical trials developed brain inflammation. The suspected culprit behind the allergic reactions in Pfizer's vaccine is polyethylene glycol or PEG. Last month, the US FDA granted emergency use authorization for Moderna's vaccine. This gave the US two COVID-19 vaccines to fight the pandemic. The Center for Infectious Disease Research and Policy reported the FDA's take on allergic reactions. Allergic reactions to PEG are believed to be rare, but being used in vaccines showed a different story. Vaccines from Pfizer, BioNTech, and Moderna include PEG. This is a critical component of these drugs. It serves as a part of the lipid nanoparticle bubble, which stabilizes the mRNA molecules of the vaccine. People should know that PEG is not exclusive to COVID-19 vaccines. Many pharmaceutical products like laxatives use PEG. It's also the main ingredient in personal lubricants. Outside medicine, PEG acts as an anti-foaming agent in various foods and drinks. The US CDC offered insights into COVID-19 vaccine allergic reactions. For cases of severe reactions, the most common event is anaphylaxis, which is treatable with epinephrine. People who had a severe reaction to the first dose must not get the second dose. Anyone who had a reaction to an mRNA-based vaccine should avoid mRNA vaccines. For those with non-severe allergic reactions, the most common events include hives, swelling, and wheezing. These may happen in 4 hours after vaccination. Anyone who developed these reactions from an mRNA vaccine should avoid other mRNA vaccines. If they develop the reactions after the first dose, the CDC does not recommend getting the second dose.